Good morning. I'd like to thank the organizing committee for inviting me over here for this excellent conference. And a special thanks to my friend, Professor Dr. Fatih Demirci, who contacted me right at the beginning of the organization and almost insisted me to be here. And thank you very much indeed. I'm glad to be here. So I'll take probably 20 minutes or so to talk about gastrointestinal symptoms and how evidence-based phytotherapy can be used or have been used in various parts of the world. So my talk will consist of 5 different sections. I will start with a brief introduction about GIS, and then we'll move into the definition of phytotherapy and how it works. And we'll talk about evidence-based phytotherapy in general, and then we'll focus on some specific examples of phytotherapy which have been used to treat GIS symptoms. And then I'll conclude the talk. So let's look at the GIS. It is known, you know this figure, but still it's just to refresh the memory of what is GIS. Starts from the esophagus right at the top and then goes all the way down to the rectum. Thus, anything within this system is GIS. So any symptoms associated with malfunctioning of certain areas within the GIS, the GI tract are the GIS or gastrointestinal symptoms. They are not definitely the killing diseases like cancers or heart diseases, but if we look at the statistics, I'll show you some statistics, we'll see that still it is incurring huge number of expenses for any healthcare systems, because regular visits to the GPs with the symptoms is a very common issue. So if you look at the symptoms that are included within the GIS, that will start with heartburn and it will go all the way to IBS, which is irritable bowel syndrome, and also it includes hemorrhoids. But if you look at the most common in terms of the GP visit, that's the general practitioner's visits, it will include heartburn, it will include indigestion, dyspepsia, bloating, diarrhea, constipation, and hemorrhoids, and obviously IBS. So let's look at some facts. More than 60 million Americans have heartburn once a month. This is quite a huge number. And if you look at the UK statistics over the last few years, there has been an increase from 11.6 to 17.1 just over the last 10 years. Indigestion and dyspepsia in the UK affects about 40% of the population. Again, it's a quite large number of people suffering from these symptoms. And in terms of cost, you can see that in the UK, it is £1 billion spent to deal with dyspepsia and the treatment of dyspepsia. Again, another very common GIS symptom is constipation. Again, 2.5 million doctor visits was in the USA, and also in 1 in 7 adults, and especially 1 in 3 children in the UK suffer from this symptom. Diarrhea is another symptom which is quite common. It can be symptomatic diarrhea or it can be infectious diarrhea caused by various viruses, bacteria, or other microorganisms. But again, if you look at the global statistics, it's quite amazing. It's 1.3 million deaths because of diarrheal diseases. It doesn't stop there. I think it is more prevalent among children, and especially children below 5 years old. They die from diarrhea more than adults. About 10 to 15% of the adult population in the USA suffer from IBS, that's the irritable bowel syndrome. Again, it's quite a huge number of population suffering from these symptoms, and it is even higher in the UK, which accounts for about 20% of the population suffering from IBS. So that's the scenario. Although they are symptoms, but they are not negligible. We cannot really ignore those symptoms because in the end, they incur cost to the health system, huge expenses, discomfort, and quality of life is decreased. What is a phytotherapy? Very simple definition. Plant-based therapy in the treatment and prevention of diseases. It's not only to treat diseases, but also it is to prevent diseases as well. For example, chemoprevention is one of the areas that has been looked at now. If we can prevent cancer happening, that would save money and suffering of patients. So that is also included within the greater aspects of phytotherapy. But this term was first coined by Henry in 1913 is quite old avenue of science, but it is still thriving, and the popularity of phytotherapy has increased over the years. And if you look at the sales figure, I'm not showing the sales figure, but there's a steady increase in sales of phytotherapeutic products over the last couple of decades. If you look at phytotherapy, there will be two different sections. One will be traditional, another one will be rational, or we call it evidence-based. Traditional one probably in most cases doesn't have that appropriate evidence as such, but they have been used several years, thousands of years, so from the practice side of things, it has been accepted and it has been used for several years. But as a scientist, we look for answers, we look for rationale, why certain plants should be used or not. And when we introduce that scientific criterion into the phytotherapeutics, that includes the rational phytotherapy, where we look for the evidence of efficacy, we look for the toxicity, we look for the side effects, interactions with other conventional drugs, etc. And that will constitute the rational phytotherapy, which is the modern aspect of phytotherapy. And few examples, as you can see, St. John's wort extensively worked in scientifically, phytochemically. We know what it contains. We know the quality aspects of it. We know the toxicity. We also know the interactions of St. John's wort with other conventional drugs that we take for various purposes. Another example will be ginkgo biloba and then black cohosh. These are the three quite modern examples which and where we have seen the use of rational phytotherapy with adequate information based on evidence. Let's move on to evidence-based phytotherapy. Before moving on to evidence-based phytotherapy, let's quick look at the definition of evidence-based therapy. Simple. When you do a therapeutic intervention, there has to be some evidence-backed approach. And when in medicine, we utilize appropriate evidence, which can be clinical evidence, which can be scientific evidence, to back up the use of certain therapy, that is evidence-based therapy, which is quite okay with the conventional medicine, but it can be quite difficult for phytotherapeutics because of various aspects. I'll go into that in a minute. But very similar, evidence-based phytotherapy. Evidence-based phytotherapy utilizes rational approaches based on scientific and clinical evidence to ensure therapeutic efficacy and safety of plant-based therapy, and to offer informed and improved patient care. These last two words are quite important. One is informed. What you are using, you should know what you are using, and also the whole aspect will be to improve the care of the patient. So these are the two vital aspects which have to be incorporated in evidence-based phytotherapy. And there's an excellent review article by Colato, published just last year, which covers various aspects of evidence-based phytotherapy and their problems and bottlenecks, etc. I was talking about that it is not easy to incorporate evidence-based phytotherapy because there are some variations. But before that, when we do phytotherapy, we have to recommend phytotherapy on the basis of the best scientific evidence. Not necessarily we have all the answers to all questions, but we have to maximize the answers that we already have. We have to provide safety data about toxicology, possible interactions, as I have mentioned, with either with other drugs or with food, and also any other body systems. And we have to optimize clinical practice of phytotherapeutic products, assess the quality of phytotherapeutic products. These are the four key criteria for evidence-based phytotherapy. Now, phytotherapy in the use of GIS can be traced back several thousand years, and also in the earlier publications like by Papyrus Everus, and even in Chinese publication, they included various plant materials based on traditional practices, information based on traditional practices to treat GIS. But in the modern compendia, you'll find that about 30% of the plants mentioned in the compendia, you'll find that they are somewhat related to GIS treatments. And again, this guy, Olaf, published an excellent review on this aspect. But interestingly, he grouped the plant materials or phytotherapeutics into various categories. He called Amara, I'll come into that, Aromatica, Amara aromatica is a combined one, alkaloid-containing plants, and various other things. But as a phytochemist, we would probably group them into chemistry or chemical aspects, or if you are a pharmacologist, probably you would have grouped them into the actions like either it is anti-diarrheal or anti-dysentery, etc. But he rather took a mixed approach, and I'll come to that. He called Amara plants, which normally contain beta substances. It can be any beta substance, and they have effect on gastric secretion and GI motility. And the examples can be Benedict's thistle and Eologentian. And as you know, that as a phytochemist, we know that cynin-type sesquiterpenes are the main components. Most of them are bioactive, has effect on GI motility and gastric secretions. And Gentiana contains mainly saccharidoid glycosides. Again, they have effects on various GI tract and GI motility. But if we summarize the activity of these Amara sort of plants or phytotherapy, you'll find that they cause these effects by hyperemia, or that means that it increases blood flow into the mucosa, and it increased gastric secretion, and also it enhances gastric emptying. These are the three criteria they induce when you take Amara sort of plant materials. And in addition to those, they also increase bile secretion. All are good for the GI symptoms. Aromatica, he mainly termed a group of plants which contain high amount of essential oils. They may contain mono and sesquiterpenes. It can contain alcohol, aldehydes, simple ketones, etc. But they are normally spasmolytic, and they also can stimulate peristalsis. And if we look at the examples, there will be very well-known plant materials or medicinal plants, caraway, carum carvi, and the main components, as you know, carvon limonin, marticaria, chamomile, again, as mainly sesquiterpene or essential oil component, standard components, monoterpenes, mentha, piperita, peppermint, lemon balm, all are terpenoid, monoterpenoid, sesquiterpenoid containing plant materials. And if you look at the caraway, the main indication probably in its use in the treatment of heartburn. And it's well proven. There are several articles proving its effectiveness in treating heartburn. And similarly, chamomile is among many other indications. It has been successfully used to treat dyspepsia. Again, it's very well documented. There are clinical evidence in support of its use in dyspepsia. But in relation to chamomile, probably it may be worth mentioning that it's one of the plants which is suspected to be used by one of the early human beings about 60,000 years ago, called Neanderthals. When they took their teeth and teeth debris, they found two different plant materials. One was chamomile, another one is, I'll come into that the next slide or the slide after. Peppermint is again indicated for dyspepsia, for the treatment of heartburn and indigestion. Again, it's very well proven, and there are several products based on mint are available over the counter or even under prescription medicine. Lemon balm is another one which can be used to treat nausea and indigestion. Again, I'm selecting these plants because there are enough evidence in the literature. If you look at the literature using these keywords, you'll find that there are several studies starting from standard scientific studies in vitro. There are studies involving animal and in vivo, and also there are some controlled or limited clinical trials in support of their uses. Amara aromatica is a combination of two, so it has beta principles as well as the essential oil contents. And the other plant, Achillea millefolium, which was also used by those Neanderthal human beings in 60,000 years ago, which have been found from their teeth debris analysis. And this Achillea millefolium is quite good to treat dyspepsia. Acorus calamus is one of the aromatic plants, in fact, and it is indicated for the treatment of chronic dyspepsia. Again, there is enough evidence, clinical evidence, to prove its efficacy. Angelica archangelica mainly contain various sorts of coumarins, but they have been indicated for the use of dyspepsia in various countries. and there are several review articles, a systematic review looking at the bioactivity and their uses as phytotherapeutic products and safety as well. Artemisia absinthium, main content is absinthin, as you can see in the structure on the right-hand side, but they have been indicated for dyspepsia and for the treatment of constipation. And then we come to the alkaloid-containing plants, and I've just cited one which is very well-known, Atropa belladonna. It's not as safe as other drugs, but it can be, in some cases, used to combat stomach pain and also to treat constipation. Another very common and well-known plant is licorice, which is quite effective in the treatment of GI inflammation, very active, and Potentilla arsenicina, again, intestinal spasms. So these are the plants, again, numerous examples can be found which show the effectiveness and also safety of these plants. Ginger root is another one which can be used to treat nausea, and again, very effective in the treatment of heartburn and also irritation of esophagus. If we move on to the Chinese, and probably in the whole world, the Chinese herbs or Chinese herbal medicine has the biggest market in terms of the earnings and export. It's over several billions, and it is steadily increasing, and the quality of investigations that are now being carried out in China is quite enhanced. It's very good quality. There are quite large number of in vivo assays, in vivo studies on various Chinese products, but I'll just cite one or two prescriptions, Chinese herbs, which are commonly used to treat GI problems or GI symptoms. And this is the one which comprises, as you can see, 6 different items, like hawthorn, barley, rice sprout, unripe bitter, etc. And it is quite successful in the treatment of indigestion. Another one which is successful in treating IBS and which is very popular in the West comprises maybe 7 or 8 different ingredients based on various plant materials. And you can see that it includes ginger, it includes peony, it includes tangerine peel, etc. Papaya, carica papaya, which is a very common fruit, especially in the Southeast Asian countries, including Bangladesh, India, Sri Lanka, Nepal, etc. And it's eaten as vegetable. Either you can eat as unripe or ripe. Tastes are different, obviously. But it's a very good remedy for treating various GIS or gastrointestinal symptoms. And it can start from constipation, heartburn, and even IBS. And it's very safe, and it's very effective, and it's been used thousands of years by various people as vegetables, and there's no known side effects except for pregnant women. And there are a few others which can be used to treat hemorrhoids. Blackcurrant is one of the best examples. Oat bran, it falls into the food items, but still it is quite effective in treating constipation and thus alleviating the problems associated with hemorrhoids. Home oak is, again, is a very good treatment for hemorrhoids, proven treatment. There are evidence provided by various clinical studies. Horse chestnut is another one, and again, you can see that the methods are described here, how it can be used, how it can be boiled, how many times, how many minutes, and also the amount of the product. Mint, again, is very effective, again, in the treatment of hemorrhoids, and plantain is probably one of the best examples for the treatment of bleeding hemorrhoids, and it's been very popular in Africa and also in Asian countries. Again, if you need more information, there's a very good review article by Abskal and Yarnell published in 2005 on these issues. To treat constipation, there are various very well-known products. As you know, that Senna has now been incorporated into the prescription products as placed in the UK. On the right-hand side, you can see the examples Manivac, which is a combination of Senna and Isabgol, another plant products. So they are used in the treatment of constipation. And similarly, there are various products based on cascara, frangula, and aloe, rhubarb are available for the treatment of constipation. Again, enough evidence have been provided for the efficacy of these products, toxicities are clear, adverse effects are clear, and possible interaction with other conventional drugs are also provided. A simple example of how these clinical studies can be done probably can be this curcuma study, which was done to see its effectiveness for the treatment of IBS. Again, it's published in 2017 by Alt et al. And they used clinical approach, introduced various patients, I think it was over 1,000 patients, and they found it quite useful. And now move on to the anti-diarrheal medicinal plants. That will be the last section I'll be covering. And there are various plants. As I said, that diarrhea can be of two types. One can be non-infectious. It's not because of the infection necessarily, but for various other reasons. And the other one is infectious diarrhea, which are difficult to treat, not necessarily successful with phytotherapy, but non-infectious diarrhea can be treated in most cases by appropriate phytotherapeutic intervention. And phytotherapy in antidiarrheal situations, they work by offering antispasmodic effects, delaying intestinal transit, suppressing gut motility, stimulating water absorptions, and reducing the electrolyte secretions. These are the 5 main mode of actions for phytotherapies used to treat diarrhea. And as we know that many plants contain tannins, flavonoids, which are known to produce antidiarrheal effects by increasing coloning water and electrolyte reabsorption. I'll just cite a few examples. Jatropha is very effective in the treatment of dysentery and diarrhea. In India, again, there are several evidence to prove that, clinical and also scientific. And another Indian plant is Trichodesma indicum, again effective against diarrhea. And you can see that Eagle marmolas is also effective. Acorus calamus has been indicated for the treatment of diarrhea in combination with another plant called Pongamia glabra. And there are a list of various other plant products which are very popular in the southeast of Asia for the treatment of diarrheal symptoms. And again, there are enough evidence to prove their efficacy. So that leads to conclusion, a very simple conclusion. There are convincing evidence for the efficacy and safety of phytotherapeutic agents that are used in phytotherapy of GIS. Not for everything, but for the mainstream phytotherapeutic agents which are used to treat GIS, there are adequate evidence present in there. However, it is extremely important to carry out unbiased, systematic, and critical review. That's the bottom line. Like, for example, when you are looking for anti-cancer phytotherapy, and if you look for the evidence which are based on simple MTT cytotoxicity assay, that is not really something which can tell you about the anti-cancer efficacy. So when you are reviewing literature, you have to be unbiased and look into the real figures, real documents, and real evidence which can prove the efficacy, and at the same time prove toxicity or lack of toxicity. Published literature on efficacy and safety of phytotherapy, and to evaluate the quality, robustness, reliability of published data, as I have mentioned, before accepting them as evidence for any particular phytotherapy, just for example, phytotherapy of GIS. Thank you very much for your attention.